Hello and welcome. In this video we are going to summarize a condition known as pulmonary embolism. What is PE and how does it present? A pulmonary embolism is a blockage in the arteries of your lungs. Over 90% of the time, it's caused by a blood clot from a deep vein thrombosis, DVT, in the leg that travels to the lungs. How does a patient look? The classic symptoms are often vague. Sudden shortness of breath is the most common. Sharp, pleuritic chest pain that worsens with breathing. A fast heart rate, tachycardia. The diagnostic pathway. Diagnosing PE is all about risk stratification. First, use a clinical score like the Wells score to determine if the patient has a low, intermediate, or high pretest probability. Your next step depends on that probability. For low or intermediate probability patients, get a D-dimer test. If the D-dimer is negative, PE is ruled out. If it's positive, you need imaging. For high probability patients, skip the D-dimer. They need to go straight to imaging. The gold standard for imaging is a CT pulmonary angiography, CTPA. It gives us a direct look at the clots. If a patient has a severe contrast allergy or kidney failure, a ventilation perfusion VQ scan is the best alternative. Treatment is also completely guided by risk. For high-risk PE, the unstable patient, the goal is immediate reperfusion to remove the clot strain on the heart. The first-line treatment is systemic thrombolysis with a clot-busting drug like alteplase. If thrombolysis is contraindicated or fails, the patient needs an emergency procedure, either a surgical embolectomy or a catheter-directed treatment. For intermediate-risk PE, the patient is stable but has signs of right heart strain on imaging or via biomarkers. They need to be hospitalized and started on directed oral anticoagulants with close observation. If the patient is deteriorate, we can shift to systemic thrombolysis. For low-risk PE, the most common group, the patient is stable with no signs of heart strain. The treatment is anticoagulation, direct oral anticoagulants, DOACs like apixaban or rivaroxaban as the first-line choice. For long-term care, anticoagulation typically lasts for at least 3 months. Finally, IVC filters are not a primary treatment. They are reserved for the rare patient who has an absolute contraindication to all forms of anticoagulation. Thank you for your time. Don't forget to subscribe for more concise medical content.